Let's talk about insurance.
That's a big one, Logan. And, I think when you start talking about insurance, a lot of people go directly to Medicare supplements, Medicare, health insurance. And why do they go to that? Because that is one of the largest budget items that people face as they head into retirement. How do you tackle that? Well, you got to go into that with your eyes wide open, and you got to say, hey, before I get on Medicare, what are the premiums going to look like? You need to get quotes. Once I get onto Medicare, do I need the Medicare Advantage plans? Do I need a true Medicare supplement? What's the cost of both? What's the out-of-pocket maximum each year? What plan works best for me? And so I think when we say insurance, that's where a lot of people's minds go.
Yeah, and I think too, it's just not that pre-retiree, that person that's close to retirement. It's the 30-year-old, 35-year-old that has a family, starting a family. It's uncertainty. Hey, I got this $500,000 term. I got some group life insurance. I'll be all right. Have you done a needs analysis to look at it?
Right.
That's not something that you want to guess on.
But people do that.
Why? Because you don't know what you don't know.
Right. Well, most insurance, Logan, is sold and not purchased. And what I mean by that is the insurance industry, especially the life insurance industry, has trained some of the best salespeople in the history of the world. And they're trained to sell an insurance policy. And there are so many different types of policies that it can get super confusing. And so when you have a life insurance agent comes and says, hey, you need to do this, you need to do that, you can take this policy and buy it, and it'll pay for your kids' college, and it'll also give you money for retirement. And insurance is a risk management tool. And in some cases, insurance can be used as a tax planning tool as well. But those are two totally different types of policies for two totally different types of situations.
Right. Absolutely. And you and I see it all the time. It's, long-term care. Okay. That's one of the most oversold things we see. But what you need to have a plan, because it is uncertain. If you don't have a plan and you get to that point where someone needs the care, you should be stress testing that within a financial plan.
Let's talk a little bit about that, because I think that's a critical one. And there's a high degree of uncertainty in people's lives as to what is my medical need going to be in the future. Am I going to go into a long-term care facility? Will my wife have to go into a long-term care facility? Am I going to have in-home health care? How am I going to pay for that? That should all be part of your plan, right? So just as a scenario, the way that you should be planning that is you should say, okay, let's create the Goldilocks plan first. And that Goldilocks plan assumes that you go into retirement, you live happily ever after, we have good returns in the portfolio, nobody ever gets sick.
Both lived to 95.
Both lived to 95, pass away within a few days of each other, both lived a long, happy, healthy life. That's the Goldilocks plan. Once we have the Goldilocks plan, then what we got to do is we got to stress test it. We got to say, what happens if the husband or the wife has a stroke at age 75 and can no longer function on their own, and they're in a way where the healthy spouse can't care for them anymore. So now they got to put them into a long-term care facility, and let's say they're confined in that for a 8 to 10 year period. Well, what does that do to the integrity of the plan, and what does that do to the livelihood of the person who is the healthy spouse?
Absolutely. And you need to stress test those things. You need to have those conversations prior. And I think that, as we're working our way down the line here, is you talk about investing.
Well, let's go back to this. Long-term care thing first, Logan. So what I want to say here is that if you stress test the plan and you say the first spouse gets sick and goes into long-term care at 75, the other spouse lives a long life to 95, we build out the budget of what that spouse needs to have, we build out the cost of the long-term care, and if the plan still holds its integrity and it still works, then all of a sudden what that means is that couple is self-insured. They have enough to weather that storm. If they don't have enough to weather that storm, then that's when you have to go and say, how much of that potential expense do we need insurance to cover? And then what type of insurance does it make sense for me to purchase to cover that part of the expense that I need to have covered? My favorite is the life insurance policy that has a critical care rider on it. And what that basically means is if you had a $500,000 life insurance policy, you could use up to 90% of that $500,000 while you're still alive for long-term care benefits. Whatever portion of it you don't use for long-term care, it will come to the surviving spouse or the beneficiaries tax-free. So it's the only type of policy that you can put money into and know that either you or your beneficiaries will get more out of it than what you ever put into it. So that's my favorite way of covering long-term care. And then what do? You put that premium for that life insurance policy into the plan, and did that work better than trying to self-insure it?
Right, absolutely. And I think one thing that's critical, you know, if you're listening to this, and it's you can make anyone have fear around long-term care. So you also need to have the conversation of, okay, if one spouse is in long-term care, maybe we're spending $80,000 a year on that, wherever you live, it could be different. And then the surviving spouse needs X to live. What does X to live make up? Because you're probably not doing the big traveling anymore. Maybe you're downsizing. So you need to go back at that point and redefine what does life look like for the next X number of years. Because you can't just assume the same goals that you had 10 or 15 years ago are going to be relevant then too. So that's something that I'd highly recommend as you stress test that.
That's part of the what if scenario. What if one spouse goes into long-term care? What's the lifestyle of the survivor or the healthy spouse going to look like? And what's that going to cost? The other piece of that I think needs to be addressed, Logan, is it's not something that people think about in the moment, but it's something that people need to be reminded of. That particular event, while tragic in and of itself, can create amazing tax planning opportunities. Why? Because a good portion of that long-term care expense can be tax deductible. So it can change the scope of what assets you should be spending from. It can allow us to do conversions from traditional to Roth IRA, in many cases, up to a certain level with no additional taxes due because you're getting the write-off of the long-term care expense. So you don't just go into that long-term care scenario where you got a healthy spouse and one that's sick and needing that care and just go into it focusing on the care. You need to take a step back and say, what tax planning opportunities is this creating, and how can this help the healthy spouse, through their longevity years?
That's a great point. And it's really kind of what we're both saying here is when you have a big life event or a big life change, you need to take a step back and redefine the financial plan and the goals and what you're looking to do.
But if you don't have a plan in the first place, that's hard to do.
Well, then you don't have anything to benchmark off of, like we just talked about.
Right.
Starting your route to retirement.